So, what are we looking at? Gopal, tell me what I'm looking at.
So this was a patient that came to the ER for abdominal pain and was scanned on the 7500 that we have down in the emergency room. And on the conventional CT image, what you see is heterogeneous stuff in the stomach. It's stuff. It could be debris, it could be blood, it could be something the patient ate.
Pill,
no.
burger.
Anything.
But I have a feeling you're going to show me some spectral images.
Yes, so if we look at the spectral images on this patient, and this image shows you a color iodine overlay. So what we did on this image is you take the conventional CT, which is the CT scan that we're all used to, that my grandpa was used to, and you can put the iodine as a color coded display. So things that enhance or have iodine in them, and iodine is the contrast that you get injected, light up. And when you look inside the stomach, you can see a spot where there is clearly, it's lighting up with iodine or contrast.
And it's no longer the concept of just hyperattenuation. It's iodine versus calcium.
Or stuff, or
stuff.
debris.
It's purely iodine. So that's telling you, I suppose, this is a bleed.
Yeah, so this patient is bleeding in the stomach, and that truly gives us the quick and prompt diagnosis of GI bleed. Based on the diagnosis, patient was sent to GI, went to endoscopy, and what you see here is a image from the endoscopy which shows a large Mallory-Weiss tear in the distal esophagus GE junction area, which was causing the bleed into the stomach.
So this obviously sounds like it changes your workflow in general in the ER for GI bleeds, traumas. What makes you most excited about the use of spectral CT for bleeds?
So it's really what it does is it lets us make the diagnosis on the one scan the patient got. Now, in an ideal world, I would like to do a 3-phase scan with a non-contrast arterial venous phase, but we don't live in the ideal world anymore. Healthcare everywhere is so stressed right now. So with the spectral CT technology that we have, we can make the diagnosis on the one scan, the one shot that the patient got, and not have to bring the patient back and waste the time and occupy the bed that we don't have.
So faster diagnosis, also saving resources. Maybe you're preventing having to go to now nuclear medicine for a second scan or a repeat CT using a different protocol. It sounds like you're really speeding up the process.
Yes, and at the back end of it, the patient goes out of the hospital quicker.
Yeah.
Right, and hospital days we know are precious. We don't have those beds.
Besides gastric ulcers and Mallory-Weiss tears, are you looking at GI bleeds routinely with spectral now?
Yes, so GI bleeds anywhere. Stomach, small bowel, large bowel works really well to pick out these GI bleeds.
Also, by the way, trauma, I would imagine, we have these pelvic fractures all the time. And the question we always get asked, the question that we need to know is this a bone fragment or is this active extravasation requiring
Yeah, it makes it so simple, and I work in a level 1 trauma center, so this is an everyday issue with high-speed MVCs or gunshots, or, it's just picking out active extravasation is so quick, so easy, and very, very simple.
In general, because you scan body imaging head to toe, what excites you most about spectral CT and the possibility?
So what excites me the most about spectral CT is actually it connects me back to why I went into medicine in the first place, why I went through all these years of training and radiology residency and so on. It puts me back in connection with that passion of trying to help patients, so I can give them the best diagnosis possible on one scan instead of having to bring the patients back over and over again, scan them multiple times, or send them to other imaging. I want to give them the diagnosis first time, one time, every time.